Welcome back to Newstalk for this half hour. Dr. Anthony Furino is here to take your questions about orthodontics. 793-WKTV is the number to call. While we're waiting for some of those callers to come through, it's summertime, as we all know. We can certainly tell from the heat.
Yes, it is hot.
You know, are there certain things during this time of year that parents should be taking advantage of that summer vacation time to kind of get out of the way to do?
Yeah, we get obviously lots of calls in the summertime because the kids are off for school. They want to get some evaluation done on the children's teeth and so forth. And so it is a great time. Things like third molars, wisdom teeth, the oral surgeons are really busy this time of the year. And also at home, parents can look for certain things themselves if they look in a child's mouth to see if there's something that needs to be done or at least looked at. Excessive space between the two front teeth. You want to have about a popsicle space. If it's larger than that, we want to maybe have that looked at. Over-retained baby teeth, when you have multiple baby teeth hanging on for dear life and the permanent teeth are popping up and in, shouldn't have two teeth occupying one space.
Okay.
So those you want to maybe have your dentist take a look at, and if they feel an orthodontic consultation's needed, we can go ahead and take a peek.
All right, let's take some calls. If you've
Sure.
got a question, 793-WKTV is the number to call. Hello, caller, you are on the air.
Yes, hi doctor. Quick question.
Sure.
My son had his braces off probably about maybe a year and a half ago.
Okay.
Wears his night retainer every night faithfully.
Good man.
What's the follow-up care for that after they've been off for quite a while and he's still wearing them?
Okay, that's a wonderful, wonderful question. Retainer wear is indefinite. You really don't ever want to stop wearing your retainer. Teeth are kind of dumb. They don't exactly know where they should be, so orthodontists and parents and patients want the teeth to stay straight as long as possible. So they need to be reminded indefinitely. There's really no time where you can say, we don't need to wear your retainer anymore. But you can wean yourself off of your retainer. You could wear it every night to begin with, then maybe after 2 or 3 years you can go to every other night. And then I like to tell my patients that even down the road a couple of years, pop it in once or twice a week. If it fits really tight, wear it a night or two to make sure that it still fits, and then we can actually just keep on once a week.
Okay.
That'd be a great idea.
Let's take another call. Hello, caller, you are on the air.
Yes, I got a question about the dentures that snap in.
Okay.
How good are they, or what's the problems with them?
Well, you know, dentures that snap in, what really is happening here, obviously when you have dentures, you're missing several teeth or all your teeth. And the dentures are just kind of hanging on the soft tissues with just basically a suction. The snap-ins are when a dentist can go ahead and put some little implants. They're little titanium screws that actually go into the bone of your upper and lower jaw. They're very predictable and very reproducible in terms of that. And then your denture snaps in right on top of that. And it gives a positive attachment instead of depending on adhesives and things like that. It's really very, very popular now. It really works well. Chat with your dentist about it. Obviously there's a cost involved, but in terms of durability and patient satisfaction, boy, it's really high, and people tend to really love these. I don't do these things, but of course I read a lot about them. But call the dentist, and I think that you can get some good advice.
All right. Do we have any more callers on the line? If so, no, we don't. I want to ask you before we go. It's got to be kind of interesting. You know, you've been doing this for a while to see how the technology. The question about dentures kind of made me think about how far that's come over the years.
Yes. Oh, it's amazing. We actually use very little of what I used in my residency when I was down in Washington and in Philadelphia doing my residency. Basically, everything has changed. In our office, we use a wire technology, nickel, copper, titanium, and so forth. It's actually been developed for the space agency, and some of it's made right here.
Oh, wow.
Yes, and the wires actually, when they're brought up to body temperature, they start exerting a force. If it's too much pressure, we just tell people, take a sip of cool water. It decreases the rigidity of the wire, and they get a lot of comfort. It's really cool.
Amazing.
Yeah.
All right, Dr. Anthony Furino, thank you so much for joining us. We appreciate it. We'll be back right after the break.